Completely inheritable disease, thalassemia. Thalassemia is defined as a group of inherited disorders characterized by reduced or absent amount of hemoglobin, the oxygen-carrying protein inside the red blood cells. Types of thalassemia. There are two main types of thalassemia, alpha and beta. The main difference between these two are the hemoglobin. Basically, the hemoglobin protein chain, called alpha globin and the beta globin. So alpha thalassemia occurs when one or more of the four genes needed for making the alpha globin chain of hemoglobin are variant or missing. Moderate to severe anemia results when more than two genes are affected. The most severe form of alpha thalassemia is known as alpha thalassemia major. As you can see in this format, the man contains 50% abnormal alpha globin gene, and the female is normal, and the female is carrier. So the generation is 25% normal hemoglobin and 25% the alpha thalassemia trait, any minor trait, and 25% the alpha thal silent carrier. Basically the 75% normal one, and the last one is completely a patient hemoglobin disease patient, thalassemic patient. So beta thalassemia. Beta thalassemia occurs when one or both of the two genes needed making the polypeptide globin chain of hemoglobin is defective. The severity of illness depends on whether one or both genes are affected and the nature of abnormality. If both genes are affected, anemia can change from moderate to severe. Beta thalassemia is grouped into three categories: minor trait, intermediate, and major. Basically, major is called the Cool's anemia. Beta thalassemia major is also called Cool's anemia, a severe condition in which regular blood transfusion are necessary for child to survive. Beta thalassemia intermedia. Children with beta thalassemia intermedia have varying effect from disease. Mild anemia might be their only symptoms or might they require regular blood transfusion. Beta thalassemia minor trait. If one gene is affected, person is carrier and has mild anemia. Remember, if one gene is affected, person is carrier. So this condition is called beta thalassemia trait or beta thalassemia minor. Beta thalassemia minor often goes undiagnosed because kids with the condition have no real symptoms other than mild anemia, small red blood cells. Causes and risk factors. Family history and ancestry. Clinical manifestations include fatigue, weakness, pale or yellowish skin, facial bone deformities, slow growth, abdominal swelling, and dark urine. So, so this is the clinical presentation of a thalassemia patient. This is how the thalassemia patient can be treated by blood transfusion. So as you can see in this picture, the children have enlarged liver and spleen, heart defects, abnormalities of the urinary system or genitalia. HB Bart syndrome can cause complications in pregnancy such as high blood pressure, premature delivery, abnormal bleeding, or jaundice. Medical treatment of the thalassemia patient. Folic acid oral, basically this is the medicine one. Folic acid injection, this is the drip one, and defoxamine injection. Folic acid oral. Folic acid is a man-made form of folate, which is B6 vitamin naturally found in some foods. It is needed to form healthy cells, especially the red blood cells. Active forms of folic acid are L-methylfolate and levominofolate. Folic acid supplements are used to treat or prevent low folate levels. Folic acid injection uses Folic acid is used to treat or prevent certain anemias caused by poor diet, pregnancy, alcoholism, liver disease, certain stomach intestinal problems, dialysis or relief symptoms such as unusual tiredness and diarrhea. This is the special injection, as I discussed earlier, deoxyriboxamine mesylate.